Welcome to another Digital Health Update with Dina and Mina show.
And today our guest is Stefan Brämberg. Welcome.
Thank you.
And Stefan is CTO of Ascom Wireless Solutions, a world leader in providing on-site communication tools for critical processes such as healthcare. And more Ascom Wireless Solutions is moving into healthcare, and that's the reason why we have Stefan here today with us. Welcome.
Thank you.
So, Stefan, could you please tell us what Ascom Wireless does?
So we are a global provider of mobile workflow solutions. So we have a broad product range from bedside and devices to handsets, and also we have a suite of software that connects to the hospital ICT system. So, for example, just to give you a feeling for what our installation would look like, would be a nurse call system by the patient. We would have connectivity to different medical devices. We would have a software that's connected to the ICT of the hospital, and all of that is brought out to our handsets. So you can actually get all the information from the patient through the workflow and all the way out to the patients. That's what we do.
So the aim is to improve efficiency of the hospitals,
Yes.
right? And why is that so important?
Well, I mean, it's very important, and we all read about the demographics, and we all know that we are living longer. But we will also be consuming, each of us, when we get older, much more healthcare. And so we are living longer, consuming more healthcare, and we will be less people that are caring for us. All of those are factors that unfortunately is on the wrong side of that equation. So it's very simple and a bit scary from that point of view, that we have to have a much more efficient healthcare.
So why do you think that data from electronic health records should be available on mobile devices?
I mean, that's also something that we work a lot with within Ascom, and we do research. That's what has changed us a lot. We are now working in hospital. We are shadowing hospitals and so forth, or shadowing people working in hospitals. And I will give you one example. For example, when we are working with caregivers, they go out and take all the vital signs at all the different patients, and they record those on their hands or on yellow stickers. They put on different things, and then all of a sudden they have to do something else, and then they are running back and finally put it into the EMR. So our research shows that more than 30% of their active working time is about retrieving and putting things into the medical system, which is actually waste. So if you could have your things put in at the point of care, you retrieve your information at the point of care, you save a lot of efficiency and improve quality of care as well.
So by transferring electronic medical records on this fantastic device, we can reach up to 30% of improvement in efficiency.
Yes, we can.
Great.
So on a more general perspective, what excites you about digital health?
I mean, I think it's a bigger revolution than many of us have really seen yet. This is the first time ever where we start to record medical data in a structured fashion with all the EMRs and so forth. It is all, I mean, it will be accessible now. Now that could be also a bad thing, because that means you have a huge amount of information. Now, the second movement that is happening at the same time is also this big data movement that you're able to, by analyzing an algorithm of all that big data, make sense out of. So first you have all the inputs, you have the methodology to make sense of it. That is a fantastic revolution. I think that is bigger than we think. So that means that we are able to do predictions, we are able to do enhancements of all the results to help all the physicians and the nurses to do a better job. So that's a revolution, if nothing else.
So according to what you are saying, one of the downsides of this digitalization is still that data become available. So do you see it as a risk for digital healthcare development?
I mean, you have to, the risk that might be there is, of course, personal integrity, and I think that all of us who works in this field have to take that very seriously and work with it. But there are methods and way of handling that one. I would say, on the contrary, probably healthcare is the area where you have most control if you compare with all the Facebook things and what you do. So, carefully used and in a well-handled way, it will be fantastic.
So what do you think are the most common misapprehensions when it comes to digital health?
I think one of the big misapprehensions would be, for example, that it will be only robots that will be treating us in the future. I don't think that will happen. You have to remember that the digital health is a tool. It will help us. It will help the physicians, the caregivers to be much more effective, but you could never replace those. You have to remember that human being health is about the physical side, but also on the well-being side, and that one you can never replace.
So what then is the immediate future of digital health? What can we expect happening next?
I would say right now the low-hanging fruit you will see is as I said, the medical records are there. We are bringing out smart devices that are able to bring all that stuff in. I mean, for example, one of the applications we see short term is drug administration, being able to have a barcode scanner, which we have here. You can scan yourself, you can scan the patient and the drug, and you go into a system and check: are we going to give that patient that drug right now? And you get a yes back. That's a tremendous, shall we say, a change from what we are doing today. So those things will happen now.
And main challenge currently?
Hospital organization. That's the main challenge, because of course also the hospital, it's not a technology problem nowadays. It's how do you go from a departmental organization to a flow organization into hospital. That's a challenge for the hospital.
So on another level, how do you see the human beings, whether it's healthcare professionals such as doctors or nurses, or even patients, fit in digital health?
I would turn that question the other way around. I mean, it already starts. It starts with the human being, and then digital health is a tool to make that happen. I only see upsides. If we are careful with the personal integrity, I think all of these things are just a help for the digital.
Thank you. So on this very positive note, we would like to thank you for coming here, and please stay tuned for next Digital Health Days video that are coming soon. See you!